Throughout its journey, various organizations have come forward to support this leading health initiative. In its fifth edition, the India Health and Wellness Summit, in association with ET Now, has been powered by Podar Wellness, is supported by Dettol City Shield, Pure Air Companion, Philips Air Purifier, Dr. Shikha's Nutri Health, Sankalp Taru, Paras Healthcare, Indraprasth Apollo, Multani Kuka, Prabhatam, Health Biz Insight, NABH, Camlin, Modern Medi Health, BioVoice, Right Bite Max Protein, and Teamwork Communication Group. We will now move on to the fifth and arguably the most essential pillar of health, which is communications. It plays a vital role in engaging people, spreading the right information, and ensure engaging people and ensure health-seeking behavior. However, there are challenges of over-communication, miscommunication, and lack of communication altogether. This is where, while communicating health, the right message is key to drive the right change and make the right impact. For this discussion, I would like to call on stage Professor Pankaj Gupta, the President of IIHMR University. I would request Professor Gupta to please come on stage. Dr. Gupta comes in as the third President of the IIHMR University. He brings with him 25 years strong experience in academics as a teacher, leader, and institutional builder, and has a strong understanding of higher education worldwide, especially management education. Please welcome Professor Pankaj Gupta. I would also like to welcome on stage Dr. Prakriti Poddar, Managing Director, Poddar Wellness. She has been working in the field of mental health since 1999. I would request her to please come on stage. And she is a certified counselor, a clinical hypnotherapist, a regression therapist, NLP practitioner, and runs her own practice since 2002. And of course, Dr. Bobby John will be the moderator for this panel. Over to you, Bobby.
Ladies and gentlemen, thank you for staying with us for all of this afternoon, the early evening. This is our last conversation session before we slip into our awards ceremony time. We are pleased to have Professor Gupta and Ms. Poddar to join us for this summative conversation. We've been talking about how there are different pillars of health. This is where we want to pull it all together. Professor Gupta, you know very well, more than most, that health is not merely the absence of disease, but it's complete physical, mental, and social well-being. So which is far bigger than what we do at hospital level or at the lab level. It's much, much bigger. Could you tell us, what is this big thing called health and wellness all about? If you could take the mic, please.
Thank you so much, Bobby. And you really made a very, very profound opening statement. And also thank you, Kamal, for inviting me here. Am I audible?
A little bit more closer, sir.
Okay. See, we have seen many speakers speaking about the preventive part of the health. And if you say that, also what Shikhaji was mentioning in the earlier session, what we talk about health means swasth. And swasth means what? Swa me sthit. Somebody who is sthit in self. जो स्व में स्थित है उसको स्वस्थ कहा जा सकता है. And then it is a question that how it is related with the real health and what is opposite of that. See, the question is, many times we are running, one is the way that we have some disease and we know how to correct that disease by different ways of doing the things. But there is much beyond, and that is the being part, that how we impact the being and how that is really impacting the whole health domain. So the thing is, people sometimes are living in abhav or prabhav, but they are not living in swabhav. And from swabhav, there is swadharma. That means what is one's own inner nature. And when people are aligned to that inner nature, and the inner wisdom is already there with all of us. एक होता ना, the Guru is already within us, and we are searching here and there, everywhere. So going back to the roots, understanding who we are, what really inspires us, what motivates us, and living a holistic life. People are just trying to running here and there because others are running, and that is creating enormous amount of pressure on everyone. And that is creating us, जो श्वास से हटाने की जो बातें होती हैं, तो उसकी वजह से एक बहुत बड़ा प्रॉब्लम है. देयर इज अ बिग प्रॉब्लम देयर. So we need to understand the whole holistic side of the thing, and on which I'd be happy to share more. Shall I carry on?
Please do.
Okay, okay. I just made a couple of points there. So one thing which I mentioned, like if you talk about a squirrel, she is very happy running, jumping here and there on a tree. But if she feels that, okay, I'm not good enough, I'm not able to swim like a fish, then she will feel I'm not good enough, and that would be a big problem. She may be healthy in running here and there on the tree, but not healthy enough to swim. And there is no way that she is unhealthy. She is perfectly healthy. Or in the same way, somebody is designed to do certain things. Say, for example, an apple seed has to be planted in Kashmir. But if you plant it somewhere else, it will not be giving the desired impact. So the apple seed possibility need, I'm just giving a figurative explanations. And a coconut seed to be planted in Kerala or Goa. And in the same way, we are also, if you look at the ancient science in India, that we have got a different kind of personalities, the different kind of gunas are there, the different kind of vrattis are there. So therefore, it is not like that ancient Ayurveda system, or which was more based on the prakriti and, what we can say, prevention, what we say, and a model of holistic living, which was based on not getting happy someday, but you are happy and fulfilled right now, right this very moment. So, because many of the diseases have their own origin when you are not still, when you are not happy from inside. And we see that cortisol level going up, and a lot of other problems keep happening. So, so these kind of, and also when we talk about the new and innovative way of handling and healing, so we see that the data is helping us, many other new inventions are happening. But it's still not, bigger innovations are not happening. Because again, I will go to the being part, because when you talk about the being, there is a way when you know that I don't know that I don't know. Most of the time we are fixed that I know that I know, or I know that I don't know. But the bigger things are there. And for that, stillness, silence, meditation, mindfulness, a combination of Gyan and Dhyan, these things are also very, very important. So that will lead to, and also when you talk about the joy of giving, not only the swas, but the sehat and seva. We, the medical professionals, we may say that, okay, this government has to do, this, that person has to do. But what we can do as an individual? If we start, like I'm the president of my university, so I feel that my students and my faculty, wherever I can impact their life, and also bringing in them certain values which are based on seva and sehat and swasth. So that is how we are able to create more aware individuals who are not only thinking that I, me, myself only as a boundary of my love, but that may be the center, but not the boundary of my whole love. So in this way, it is a matter of taking self-responsibility, the holistic way of living, and going to a stage where you feel happy right now, right here. What we say that the chaha miti, chinta miti, manwa beparwah. जिनको कुछ ना चाहिए वो शाहन के शाह. So that kind of mindset when you have, and a lot of research has happened, I can quote those research, that when you have this kind of very uh, free mind, and that lead into a lot of happiness all around, and that's what I would like to say at this moment.
Thank you, Dr. Gupta. I mean, because while when I started off and I quoted the WHO definition of health, which is not merely the absence of disease, which is in the body, but also mental, which is the space that that's not readily apparent, but very, very active and driving us. And then there's a social dimension, which is how we are kind of functioning as part of a community and in relationship with one another. All of these three dimensions, and I dare say the spiritual one too, pull together into a sense of well-being. Now, I know that the government has talked about not only the primary healthcare centers and a differentiated care level of primary, secondary, and tertiary in the body or the physical space, but there's also this push towards 150,000, 150,000 wellness centers. Now, they don't necessarily take on all of the things that you're talking about, but it's definitely a step in the right direction. And I think you had, Dr. Prakriti, earlier on in your, when you had made your comments, you had kind of pointed to the fact that it's a lot more. It's not a lot less. It's a lot more that needs to be brought together so that there is wellness there. I want to point to three things very, very quickly. We're all getting very busy. And so is stillness a luxury? Is the ability to be stress-free a function of the amount of money that you have? Or is it, again, like the air that we talked about? Do we need to buy air or a stress-free experience? So therefore, if you don't have money, really, you'll be always stressed. And so therefore, both of them then adding up to elevated cortisol levels, which then drives everything crazy. So what are we setting ourselves up for from childhood onwards to adult experiences to an economy that's going to be driving the world? Are we really in the trajectory of health and wellness, or are we basically saying the nice things and not really acting towards it? You first and then Dr. Prakriti. Okay, you say first.
Hello.
And I'll be mindful of time too. Okay.
All right. Thank you so much. So it's a very, very interesting question that you've just asked. And I used to go for these discourses with a gentleman called Ramesh Balsekar, who's passed on. And one of the key statements he used to make is that spirituality is really just a luxury, and the people that are struggling for survival have very little time for spirituality. Having said that, Nisargadatta Maharaj was not really well-to-do, but he still managed to attain enlightenment. So really, it is how we are centered, and it's got a lot to do with our DNA. It's got a lot to do with the way in which our access to knowledge, and of course, your questions go into a spiritual belief, and because I'm also into past life regression, we've seen cases where people don't have access and wealth, but are still able to achieve that. But that's based on a lot of exposure and the kind of incidents that have taken place in their life that have caused that. It's unfortunate that most people who get into spirituality or wellness from a very deep level are usually people who've been through the most amount of trauma. Trauma pushes you into really going deep within yourself, because that is what you need to use to heal. So yes, it is a luxury, but everybody has access to it, because all it takes for us is to really breathe and to use our breath as a mobilization tool towards attaining less levels of stress. I wouldn't say completely taking away stress, but really uncovering your ability to access your own inner peace.
Right. All it takes is to breathe, and which brings us full circle back to where we started off from, that if you take a deep breath right now, in the hope that you will have a little bit of a calming effect and that you will be able to still yourself, withdraw, chances are you'll be inhaling a whole bunch of carbon monoxide, PM210 and PM2.5 laden air, which kills you. So yes, you get to a certain amount of stillness, but that's in the graveyard or beyond, and not in the here and now. 150,000 wellness centers is a great idea for 1/6 of humanity. And I think there is a rich tradition that we need to draw on to be able to de-stress at a larger population level, but to translate that into lower cortisol levels, lower stress levels, so that we don't have intentional homicide or mad driving on the streets, both of which do impact on people's lives. We have to do far more than set up just 150,000 centers. We'll have to do a lot more in the physical here and now so that people are able to step back. I want to thank you, Dr. Gupta and Dr. Prakriti. I'm just being mindful of time, of
Can I just
being
say-
able to... Yes, sir.
You don't need those 150,000 wellness centers. We just need more and more self-awareness in people.
Right.
See, the question is, we say, you need to have money to buy those, air purifiers. It is fine. But why we need air purifiers is again because we were having so much of fear and greed and unmindful consumption. So we have reached to this level. And also money is fine, but I have also seen from my own experience that the people who are not fully from within, they have more and more desire for money. But once you have going the inner journey, when you are already full from inside,
Sure.
then you will don't need that kind of a thing. And also, like we all are interrelated. Like, the trees are giving oxygen, we are giving carbon, and, so you can see that your one lung is there while you're sitting here. So we all are very much interrelated in everywhere. So maybe running is fine, but money also is fine. But we should be clear that when we are running, what is the state of our own mind? Are we restless or are we restful? So there is a possibility that we are running in the right direction with a restful mind. And we are mindful of whatever we are doing. And that will lead to a better world and maybe much better things will
Right.
follow.
So which is where we come back to it. We are India Health and Wellness Summit. We want to see the health journey actually be more meaningful in people being well, which is being both centered, being a lot more at peace, not only with themselves, but also with their neighbors in a way that brings together the harmony in the community and also harmony with nature. But then, to quote that great song from the Hindi movie, but the whole thing is that, कि भैया सबसे बड़ा रुपया. And the world keeps going around and round on that one.
लेकिन
Much
उसमें ये
as-
भी है ना कि ये दुनिया अगर मिल भी जाए तो क्या है?
क्या गम है? Right. And so with that, I want to thank...
Because I have gone into this, death simulation to the
Yes, sir.
Himalayas. So I'm sharing from my own experience.
Right. I hope that we will have many more people being able to take a leaf out of your own experience and of your counsel, that we will be able to move ourselves not only from a disease elimination paradigm to a health seeking and to a wellness paradigm in the days ahead. Thank you very much for this time that you were able to spend with us. I hope that you have, over the last 4 hours or so that we've been talking, been able to glimpse that health and wellness is many things working together. It is not one thing. It is not a prescription at a clinic. It is not a good specialist that you get to. It is things that work at the biggest air levels to the most intimate diagnostic tests that invade your body. They all work together. They are visible. They're also invisible, what works in your mind and your heart. It brings emotions and it brings your actions together to be pushing you to seek the treatments or the care that you need for your disease status, and to motivate you, as Abhishek had said earlier, to remain healthy. And I hope that this conversation that we have around, not only just in the past few hours, but as we go forward over the next hour or so, when we recognize those that have contributed to health and wellness in this country, and over dinner, that we will continue to talk, spark conversations, and make connections so that we are able to work together towards the betterment of health and wellness in India. Thank you very much, both of you. Thank you very much for being a lovely audience. A round of applause for them.
A big thank you to the panelists and Dr. Bobby John. I would request Mr. Kamal Narayan to please come on stage and give our panelists a token of our appreciation. Round of applause for them, please.